Fertility treatments can be very expensive, and they're not always covered by a person's insurance company. Some insurance companies do in fact include fertility treatment and fertility medications and the full diagnostic evaluation in their coverage plan. Some do not. And sometimes it has nothing to do with the insurance company, but specifically what the person's employer has arranged with the insurance company. It's very important that you get this information before you see a fertility specialist. There are specialists who take no insurance or take only a limited number of plans, and there are also specialists who take multiple plans. The quality of these specialists is generally the same. Some insurance plans will not cover infertility for women who have undergone a tubal ligation and want to have that tubal ligation reversed or have in vitro fertilization. Some insurance plans have certain limitations, specifically age limitations, on the types of treatments that are available. Other insurance plans will give a certain lifetime dollar amount and don't ask specifically what type of treatments are being done, but will not cover above a certain dollar amount. It's again very important to speak with your human resources department and with the fertility center, and particularly with the insurance company to determine what kind of coverage you have. One of the most important things to cover are fertility medications. Fertility medications are inordinately expensive. They can range from $75 a vial to even higher at times. Some women require $5,000 or $6,000 worth of medication in one cycle of in vitro fertilization in order to stimulate the ovaries. Those are the women who require a lot of vials due to age factors. Younger women require less medications in general, and so it can be a lot easier to handle financially in these cases. Again, you must speak with your insurance provider about the coverage that you have for fertility medications. Many centers also have fertility medications that they can give you free of charge. They get these medications from patients who have conceived successfully and have leftover medications that are in closed vials that can be given to patients. In cases in which there is no insurance coverage for in vitro fertilization, then it's important to speak to your center about the costs involved for the whole procedure. In general, in vitro fertilization costs vary by geographic location. In some centers also, special rates are given or special packages to try to handle and control the cost of infertility care. In general, in vitro fertilization will typically cost anywhere from $6,000 to $12,000 depending on the case and depending on the procedures that are required. Specifically, in some cases, sperm needs to be injected microscopically into the eggs, and that requires a certain fee. In other cases, embryos are manipulated, and that engenders a certain fee. So again, all the fees have to be determined ahead of time, and a fertility center should give you all the fees in writing prior to the start of the procedure.